Treating hypertension, let's talk about spironolactone, also known as aldactone. It's a mineralocorticoid receptor antagonist, abbreviated MRA. It's a prescription drug and it blocks the effects of aldosterone and causes a very minor diuresis. Now, this drug, it was developed not recently, folks. How about 1957? I love this drug. You know why? It really works. It's cheap and it does so much. How much? It prolongs survival as much as a defibrillator in heart failure patients. It helps treat thousands and thousands of people who are really hard to treat blood pressure problems. Why, it even gets rid of acne, facial hair, and baldness in women. Pretty amazing. Now, after the trial known as RALES, R-A-L-E-S, showed how important it is to treat heart failure, because there was no money to be made, remember it cost pennies, Big Pharma, of course, pounced with a similar drug that Pfizer made known as eplerenone. And they marketed it to similar people with heart failure, backed by really big budgets, dinners, trips for the doctors, kind of like what Eric Adams was doing, to be honest, as an alternative to spironolactone, because spironolactone also blocks male androgen hormones, and 10% of the men do develop some enlarged tender breasts, requiring discontinuation or perhaps a bro. Remember, 9 out of 10 men were fine, and the women didn't complain. Now, there began a fight between the big, evil empires of Big Pharma and insurers, and the insurers won. They refused to pay for it, even if the doctor prescribed it. $1 billion hopeful was a flop. Now, spironolactone does increase potassium. That's good if you have low potassium from your blood pressure disease or other medications like the diuretics, but bad if it's too high already. So a potassium for most people should be checked. Again, I love this drug. I use it really often. It works in so many ways, and it's very, very inexpensive. That's the story for spironolactone. I hope that helps.